Hey guys, welcome back to the latest episode of the Growing a Dental Practice podcast. I have a very exciting episode for you today. We're going to be talking all about virtual teams and how people virtually can help you as a dental practice. I am joined by Claire Frisby, aka the remote dental nurse. Some of you will already have heard Claire before. Claire is a regular, which is great to have her back. And we've also got a first timer. We've got Katey Read, aka the dental virtual assistant. So, ladies, how are you both? Welcome to the show.
Great.
Thanks for having us.
Thank you very much again.
Yeah. I said to you in a message tonight, Claire, that I would probably have to add you as a host.
Yeah, I'll just take over for you. That's fine.
Yeah, she'd be good at that.
Big, I'll come and help you.
Yeah, you'd probably do a better job anyway. But no, thank you for being on. I am really excited to talk about this topic because it's very on topic, isn't it? It's very current. A lot of people are still working from home. Obviously, not necessarily in the dental world, because obviously you have to be in the practice with patients. But there are a lot of people working from home, doing things differently and working differently. So it's the perfect time to get you both on. So I'm going to start with Katey. Katey, can you tell me a little bit about your background, how you got into dentistry, how you, I guess, then became the dental virtual assistant? How did that happen?
So I originally started as a dental nurse, and I got thrown into practice management really, really quickly after I qualified. And I've done various roles over the years in different practices, doing different offerings, working in some specialist practices, aesthetics practices, and sort of doing the more patient care coordinator kind of side of things and business growth and stuff. And yeah, so I had a really good exposure to everything. And then, it got to the point that, obviously COVID's changed like everything. And I sort of made the decision that, I want to focus on the things that I love doing. And so I thought, what better way to do that is to revive my existing business, which started off originally helping practices with CQC, their CQC inspections. And now it's kind of a mixture, which I'm sure we'll delve into a bit more in a bit. But yeah, that's where we are now. So
amazing. And how long have you been doing the virtual assistant?
Oh, don't
aspect?
ask me that. That means I have to show my age.
Sorry, Katey.
So it's a little bit over 15 years I've been in dentistry.
I was just talking about the virtual bit. You didn't have to go that far.
Okay. Oh no, I put my foot in it. Okay. Yeah. So, well, I originally started the dental VA in 2010. That was when the CQC stuff kicked off. And then it was just sort of around COVID time that the sort of the patient care coordinator side of the dental VA kind of really hit it off. Massively. So that's our main client base now. So yeah.
Oh, brilliant. So actually the business has been going for 12 years.
Yeah.
That's really exciting.
Yeah,
and that's a big achievement. Like, I keep seeing the statistic like 80% of businesses failed in like the first 2 years or whatever. It's really ridiculous.
Yeah.
So to keep going that far is fantastic. So well done, Katey.
Thank you.
Excellent. Thanks for that, Katey. And Claire, tell us about some of the things that you're involved in. I believe I'm just about to publish the episode about dental open days. So tell us about some of the other stuff that you get involved with. Would be great.
Yeah. Well, as I've already told you, Katey, 15 years is nothing. Mine's 30. How much older I am than
I did think that when I said it.
You're a little pup. I know. I mean, your experience you can get lots of experience in 5 years, 2 years. It doesn't matter really about, you can be in dentistry for 30 years and you might not have got much experience in the long run. But so my role now is changed to remotely, as we know. But I also help businesses like Katey and other dental professionals with this is what we're going to talk about today, really, working remotely, those jobs that don't get done within the practice. And we'll go a bit more into that. I don't, you've all heard me talking about dental open days and practice success and bits and pieces for that. So this is a bit more in depth, probably, of how we can help remotely or virtually, however you want to word it. And it's the way to go, I think, with a lot of things.
And I guess Claire, you obviously had your in practice career. When did it end? Was it sort of end of 2020, wasn't it? That kind of
September. My last month of working in practice was August. No, it wasn't August actually. September 20.
Yeah, and obviously the reason you've gone remote is because you moved 4 hours away, and you left us in wet, cold UK, and you went to Lanzarote.
Yes. So obviously I had to start up something. For the first 4 months. I didn't do anything. I just wanted to complete. I didn't know where to go. And then in the January I was ready to work again, and it's just gone from there. You were one of the first people I actually met online, Mike. And then it was Katey not long after, wasn't it?
Yeah.
We must be at almost the year mark, mustn't we?
Yeah.
Like sort of knowing each other. Because it's about a year ago since everyone was just glued to Clubhouse.
Yes.
Yeah, I know.
It's mad, isn't it? And now I don't know anyone who goes on it, but
apparently
I do.
Going, yeah.
Do you, Katey?
Every morning, yeah.
Really?
Oh,
but
right.
is it dental related or is it
No, business, yeah.
Business related? Yeah, that's cool. Nice. And so Claire, did you think you'd be working remotely, or did you think you'd be I don't know, sort of find a job locally, where you live?
Well, I knew I was going to do something, because I'm not one of those people, and I knew I would get work, if that makes sense. I just knew I would do something. There wouldn't be, I wouldn't not work. I even brought my scrubs out here with me, because I to keep all options open. So I've got a pair of scrubs from years ago, not the last practice I was in, because obviously I returned everything from them, but I had my own scrubs, and I brought those out here. But I've, just in case, I've even got my implant hat I was wearing, and everything, but it's just sitting in the cupboard. But no, I didn't know whether I was going to end up doing a bit of bar work or helping someone out. I was going to go around the dental practices just to see, but I didn't really. I was ready to come out of practice anyway. I was ready to stop nursing. I've been trying to do it for such a long time, which is why I got into the social media marketing side of things as well. So I was still doing that. I did that with a couple of practices, first of all, even in those first 4 months. And then it's just started growing from there. But I didn't know. I didn't know what I was going to do.
Yeah. But I love the fact that because that it's a long career, isn't it? You've got a lot of experience. You've worked hard for it.
Yeah.
It would have been a shame for you to kind of almost just sort of turn your back on it. So I love the fact that you've been able to capitalize on your experience from a place that you'd rather be.
Yes.
So you combine it. You've got the best of both. Exactly. Yeah.
Can you see the sunshine on the side of Claire's face? Whilst we're sitting here looking at grey, miserable skies.
I know. Honestly, this morning I went for a run. I think I met a friend at 6:45, and it was wet and cold and dark.
Yuck.
Yeah.
So that wasn't great. But no. So and actually, Katey, at one point, I think we're all going to go out and see Claire if you're up for it.
Oh yeah, absolutely.
Yeah. I think, as I said to you, I think I can have my own dental showcase out here, and everyone can just come.
Absolutely.
Definitely. Yeah, I'm up for that. I'd like a bit of sun, some cocktails.
Yeah.
Perfect.
Oh,
excellent. So that's a bit of background from sort of both of you. Katey, let's just sort of dive into the dental virtual assistant. What is that? What does it involve? How do you work? Tell me everything.
Well, so as I said before, there's kind of two sides to the business. So there's the practice management side, and then there's the patient care kind of side. And we, to be honest, every client is so individual. They all have their ways of doing things, you know, things that they might send out to patients, or the way that they like to do, you know, calls with patients. Or so we work with the client and we bespoke everything. So it's, you know, we work toward, you know, we work with the client to, you know, for their journey, their specific journey. And there's so much that we can do virtually. You know, there's obviously some things that we can't do, and we're honest, and we do say, you know, we don't think it's the right fit, or you know, because we feel that they need to have somebody, you know, that's a bit hands on deck, and you know, in the practice, particularly on the practice management side, because I think with the staff management, you know, you sometimes need to have someone on the ground. But then otherwise, I mean, we all know compliance is everywhere. It's not going anywhere. It's always going to be around, and it's always going to change. And you know, I think a lot of PMs, there's so much pressure on them all the time to, you know, be up to date with everything. And, you know, it's overwhelming. And, you know, and I certainly felt that when I was a PM as well. You know, I just, you know, there were days where I just thought, you know, I've got this to-do list, which is this long. And you get to the end of the day and then it's this long. So, yeah, so I really wanted to sort of aim the business around supporting, on the PM side, supporting practice managers or practices without practice managers. And yeah, and it's kind of evolved a bit. Like we were talking a little bit about like squat practices and, you know, and that kind of thing really. So and then with the sort of the patient care kind of side, then that's evolved as well. So it started with, you know, transcribing treatment plans for patients, being a contact for the patient if they want to go through their treatment plan, and you know, what to expect, sending sort of consent, aftercare, you know, all of those things. And then it's kind of sort of evolved a bit, like we get involved a bit about, you know, with helping with like leads management, you know, like if they have their own social medias. And yeah, there's so much, there's just so much. We get asked to do some weird stuff sometimes, which is completely out of the blue. Not that weird, but you know, but you know, like, you know, like we still say, because the business is called the Dental Virtual Assistant, we know that we might be asked to help with, you know, buying a patient flowers, or, you know, arranging maybe a bit of travel here and there and stuff like that. Really, it's just the ultimate goal with that is just to lighten the burden, because again, like the PM side, there's so much pressure on dentists to do all of this paperwork. And yeah, and we just want to help with that, you know, just make it a bit easier.
Yeah, excellent. And obviously you're working remotely and virtually, but I guess from a patient's perspective, you're part of the team, aren't you? Like there's no difference between yourself and someone actually in the practice. Is that right?
Yeah, sometimes, you know, I've had patients on the phone before where they say, "Oh, is the practice next to Tesco's or something?" And I'm, you know, because we often, our clients, you know, they work in multiple practices, so we wouldn't necessarily know that there's a, you know, perhaps not Tesco's, but you know, like a, you know, a remote shop somewhere that, oh yeah, it's near there, you know. And we
So
actually, and
do you
I'm scrambling around trying to find a map, thinking, oh, you know, where is it?
I was
So
say,
they
do you
do
wing it, or
believe.
do you quickly
Yeah, I do.
check
I
on
quickly
Google?
sort of,
Yeah.
yeah, try and find the location. And then if I can't, then I do say to them, you know, oh, let me look it up for you and I'll send you the address, or you know, or something. So um yeah, we you know, it's a lot of the time we get integrated into the team, so we know all of the team members. We obviously know the dentist because we want to know what treatments they provide, if they've got like these sort of things that they special things that they do, their USPs, you know, and obviously how they do things in their practice. And yeah, I mean, we're on the website as well as a team member, you know, a lot of the time, so they've got our face on there, they know who we are. as if we're part of the team, which we love,
Yeah.
because it makes us feel a part of it all. Yeah.
Excellent. Love it. Brilliant.
Yeah.
And Claire, so Katey's touched on some of the areas that she covers, sort of compliance and sort of treatment coordinator. Are there any other areas of dentistry that can be performed sort of remotely, and obviously some of the things that you can actually do as well?
Well, you find that people are so busy, like that Katey was saying, the pressure in the practice, especially at the moment, is just ridiculously busy, because half the team are ill, or, there's always, when you work in a dentist, there's always something every day that goes on and you're not expecting, because you're working with people as well. It's, you have to wing it through the day, really. Sometimes it's just, whatever happens, you have to be able to adapt. When you've got someone working remotely, they can help with that side of things because they're not in the practice. So that's one of the benefits. But where I help at the moment as well is the mentoring side of things. So you've got, say, dental nurses going into a treatment coordinating role within the practice, and they're just really, they're expected just to get on with it. Or they'll go on a course, and that course, they're expected to just implement everything that they've learned, because one size obviously always fits all, doesn't it? But, they've learned all this stuff. They go back to the practice and then realise that we don't work like that. So I help with implementing that within their practice. So, I'll run through all those things that they talk about on these courses, and I'll go through it with them. But I get them thinking about it from the practice side of things. And the same with a dental nurse transitioning into implant nursing. Sometimes they want to do it, but you haven't got time to ask the questions they want to ask. So if you've got someone who's your mentor, who's done all this and been there and seen it all, and it's virtual, they're always there. So that's how I help at the moment. But also, as I said to you, I've helped Katey with things that within her business. I've helped you with things in your business. It really can be adaptable to what's needed, and I think that's what your business does as well. At the moment, we're here to support dental practices in any way, really. And if we can't do it, between Katey and I, we probably know someone who can, or we'll do it between us. So
Yeah.
I think having the knowledge is the benefit, because you've been in there, you know what it's like in the practice.
Yeah, definitely. I think that's something that sets you apart from just a normal another sort of, I guess, general virtual assistant, is that you have got the experience. You do understand how a practice works, and that's that's invaluable, isn't it? It's not going to take you a lot of time to get up to speed with what's going on. You have to obviously adapt to the nuances of the practice, but the actual kind of dentistry side of things is covered. I love that point there, Claire, where you said it's kind of like, because there's not always going to be multiple TCOs in a practice. There might, it might be the first time they've had a TCO, so there's going to be no one with that experience. How do you get that experience in? Well, someone virtually is the only real option. So yeah, that's brilliant. Excellent. Love that. What are some of the other benefits of sort of working with someone virtually? Katey?
Well, shut that in.
Oh, come on then.
Yeah.
Go for it.
For me, it's the fact of not being in the practice and not having the distractions
Yeah.
Yeah, because you sit in your office or you sit in a surgery and you can't just do one job. I used to walk through the practice and I couldn't even get past reception before I'd had this question, the next question, and I'd walk down the corridor, it'd be another question. When you're trying to work doing treatment coordinating, you need your concentration as well. And people are in and out all the time asking questions just for looking for something, or have you rung this patient? Have you done this? And for that, I think being away from the practice is a godsend in some ways.
Yeah, absolutely.
Perfect. So I guess from your side, it means that you're more efficient, and I guess from the practice owner or the practice manager's perspective, they know that work's getting done without with the interruptions that their physical team. Yeah,
it's the consistent thing, isn't it? It's like, for us, we might have a client who has, maybe a couple of hours a day, and they always know that time is like their dedicated time where, our blinkers are on. It's just their work, and then there's nothing else going on apart from their work. And that leads on to like another benefit, which is that they only pay for the hours that we work on their work as well. It's not like, obviously some practices, they might not need somebody that's going to be a permanent member. They might just need somebody just to do like 1 or 2 hours a day, just to, so we've got, some smaller practices who don't necessarily need like a permanent member of staff to do it. And, that's where they come to us.
Because if they do need like an extra pair of hands, obviously the idea of hiring someone sort of full-time, or big expense, it's another person to manage. So actually sort of getting resources when almost I guess you pay as you go, isn't it, or on demand. That really works well.
Yeah,
perfect.
It does.
And I think you briefly touched on it earlier, Katey, but what's one of the negatives of a virtual team? Obviously there's a lot of benefits, but there's obviously going to be, it's not quite the same as having someone in the practice.
Yeah, I guess the main thing probably is that we're not always available instantly. So it's not like, if you had a full-time member of staff, then that they're in your practice and you can just go to them at any point and interrupt them like we were talking about.
Yeah.
But with us, obviously, because we do allocate our time throughout the day for each client, if a client contacts us with outside of their sort of allocated time, there's a little bit of a delay in us sort of getting back to them, because obviously we're not, we're working on other client work. So I suppose that's something that they, need to consider.
But that's not I wouldn't say that's not a huge issue, is it? It's just they've got to adapt that to your way of working.
Honestly, I've never had anybody say to me, "Oh, I wish you were available like straight away." It's never come up before, because we're still doing, the work. So it's it's never been a bother for anybody.
Excellent, perfect. Right. So now we've talked about the sort of different things that you can do virtually, and some of the things that practices require. We've talked about the benefits and a little bit of the negatives. What scenarios should someone consider hiring someone virtually? Do you see like recurring patterns, and when someone's like, I just need someone like yourselves? Yeah. Okay, your eyes just widened.
Well, so we originally thought that with the sort of the patient care sort of side of things, that we would be dealing with mainly specialists, because they're traveling around and stuff. And don't get me wrong, we do have a lot of specialists, but the super associates kind of have their their setup as well. And especially if they might have their own website, or they have their own social media, and they're doing their own sort of patient lead generation and everything. And or it might be recommendations from their patients. And that's hard. There's obviously some associates that rent a room as well, and then that brings other sort of invoicing, or billing sort of things, with answering calls and follow-ups and all of that stuff. So yeah, definitely, I think the associates definitely coming through a lot more now, I think, because they're much more independent entities than before.
Yeah,
Claire, you're going to say.
Yeah, this is what's happening. This is what I keep saying. I don't know if I might have even said it on a different podcast, probably.
Probably.
But it's almost like a new breed of dental nurses coming through and dental associates. and they're independent. They're in their own rights, and the associates now need their paperwork done. They need because everything's paperwork orientated as well, even if it's virtually no paper.
Yeah.
The admin is still there, and you're working all hours a day. You're getting these leads coming through from Instagram or wherever, the patient bots or patient boost dashboard, and all these places. But the practice is so busy, they haven't got time to deal with them all. And I think the associates themselves, are an entity in their own rights now, whereas it didn't used to be. They used to be within the practice and it was dealt with by the practice, but they're not. They're coming through as their own person rather than their own brand, rather than the practice's brand.
Absolutely, yeah.
And this is what changed.
Yeah,
that's quite a big change in the last couple of years.
Yeah,
definitely.
And also, there was what's happening is that there's team shortages. Obviously, you've heard about the dental nursing crisis. People are ill. At the moment, there's a lot of sickness around, not from COVID, but just generally because everyone's like getting back to normal. And you find that the practice managers are nursing, or the treatment coordinators are nursing. So all these other jobs in the background just aren't getting done. So this is where you've got someone who's remote. They can do those things and take that pressure off.
I think productivity as well.
It's just ongoing.
Yeah. I think productivity as well is another thing that I would add to the benefits side of things, because we don't have that the interruptions. I think we can be like super productive within an hour. Whereas if you're in practice, I mean, I remember having obviously my huge to-do list and, trying to get like one job done in an hour, is just such a task, because you are like, you might have to just, run in and, gown up and open the implant equipment or anything, or the suction's stopped and you have to go out and check the compressor, or it's just and obviously we can have that continuation, keep things moving, and also so that the patients don't drop either, because if you are, what it's like, that's your business, Mike, like if a lead isn't answered quickly, then they're going to go looking somewhere else. So
what was I going to say just then?
Sorry.
No, it's fine. That goes
it just
along
pinged into my mind, and I thought,
it is. That's what I was going to say. So, also, when you're talking to that patient on a consultation from your treatment coordinating, patient care side of things, they're getting your attention wholly. There's no phone ringing in the background or someone, like I said earlier, opening the door to see if you're free. There's none of that going on. That patient is getting that whole time directed completely at them.
Yeah.
And at the end of the day, that is what it's all about.
Yeah.
Yeah, and that will make a huge difference into like their response to the practice and their willingness to move forward with a treatment plan, because they feel like they've been looked after, cared for, listened to, I guess.
Yeah. You're building relationships, aren't you?
Absolutely.
Yeah, that's key, isn't it? Yes, that is really important. Love that. That's really good. So, scenario for you both. If I have just started a squat practice, obviously very expensive to do that. I might be really conscious about what I spend money on next. I've probably already got like maybe a dental. I've probably got a dental nurse in. She might be part-time, but there are other roles and other things that need to get done. Would it be a good idea to consider a virtual assistant or someone working remotely to kind of take that next step to start filling in some of those tasks to kind of get some of that stuff done?
Yes.
I suppose I set you up for that one.
Well, you said it all so nicely, so I just thought, there's nothing more to add really apart from that. I'm just having the website done at the moment, and we've got a new package, and one of those packages is for squat practices, or practices, acquisitions or something, because it works so well, because they don't have to pay like somebody full time straight off, and have someone potentially sitting around for some of the time. I mean, it depends on the person, but I mean, we all know how hard it is to recruit at the moment. We even recruit sometimes for some of our clients, and even it's hard. There's obviously a lack of dental nurses, a lack of qualified dental nurses, and so it's great for us, because obviously we can jump in and help, and do a lot of that for them without them having to pay somebody full time for it.
Going along with that as well is that I've had, and same as Katey, we've had people starting up squat practices, or they're buying a practice, they're taking over a practice and some just don't know where to start. They just have no idea, because they've never done it before. When you've been an associate, you don't know what's going on behind the scenes, and everything's so busy, because obviously you're just taking over, but everything needs to keep running. So you need that person who's away from the practice starting to do all the background work as well, and getting things up to date, changing all the policies over, all those different things, because everything needs changing and updating. We've had a couple of practices recently have contacted. I think they're a bit desperate to who they go to, because I think people are too busy, and I keep saying this, but I think they are going for these virtual people who've had experience in the dentist, because and they say, what do I do? They've literally been saying, where do I start? What do I do? And that's why, again, it comes back to, if you're not in the practice, you haven't got the distraction, so you can concentrate on each job and do it, to the best of your ability, and get that ticked off and done for them.
Mm-hmm. Yeah, fantastic. Love that, because I like that especially that point, especially Claire, where you said, if you purchase a practice, there's so much you've got to do just to take care of that change of ownership, and the practice is still running as normal. So like, it's not, you can't just give everyone extra work to do, because it would never get done. So having someone else come in, sort of help the transition run smoothly, super important.
Definitely.
Brilliant. All right, guys, I have loved this so far. Very informative, very useful. You can tell that you both really enjoy what you do, and obviously I know you're very good at what you do as well, so that makes it easier. What would you say is your number one piece of advice, if I had to point a gun at you right now? I don't know, I just used that phrase because that seems very aggressive. If I had to hold you to account right now, and someone is considering working with someone virtually, or taking on someone virtually, what would be your number one piece of advice of how to handle that relationship, or how to find the right person? What would be your number one piece of advice be? And I will start with Katey.
I'm always going first. I think there's sort of two main things, and I think the first of all is taking the time. Once onboarding is really important for us. We like to know everything there is to know, as much as possible. Like, there's nothing that's too insignificant for us to know about, because the more we know, especially like the little quirky things about like a dentist, or or a specialist, then that helps us, because we're passing that on to the patient, and they feel like they already know the person before they go in to see them, and that's great. So I think taking the time to spend time with us, to really get to know you guys, like as a client, I think that's one of the main things, and also treat us as if we're part of the team. you know, integrate us, tell the patients about us as well. I mean, one of my clients has got business cards for me, you know, and he gives them out, and they know my face, and you know, sorry, but you know, and then, you know, obviously when they ring me, they know that, and they pick up the phone, and we, you know, we have a chat, and it's casual and it's nice, and they feel relaxed, and it's all good. So yeah, I would say those two things are really important, you know, from our point of view.
So let the person that you're working with get to know you.
Yeah.
And also integrate them with your team, so it's just a smooth transition, and obviously from a patient perspective, it's a better experience.
Yeah, absolutely. Yeah.
And Claire?
So it goes along the same lines, really. It's communication, and that's the biggest thing, and that's what doesn't happen in dental practices very often anyway. It's hard. You tell someone, they tell someone else, or you think you've told someone and they haven't told that person, or whatever. Clear communication for me, when I'm doing the social media posting, I want to know what they're like. I want to know what the dental practice is like. I want to know what that dentist is like. Do you know what I mean? And I like to be personal with them, if that makes sense. So you can't work if you don't know the team, you don't believe in what you're saying sometimes. So for me, I like to really get involved, and I want to know everything, like Katey said. Honestly, it makes the work more, I don't know, productive. Not productive's not the word, but because we've been in practice, you know, you can say, oh, you'd be suited to such and such dentist. You know the personality of the patient, you know the personality of the dentist. And even with like treatment coordinate patient care, you know what patient would be suited to what patient dentist as well. There's little things and that's what the patient loves.
Yeah.
And in social media, you have to show that when you're doing that from the dentist as well. So that's exactly it. And it's communication. You can't expect me to just put a post on and expect all the patients to suddenly like it and everything if there's no, do you know what I mean? There's no personal stuff there. They don't know what the practice is like. They've seen a picture that's been used on several different accounts. It doesn't mean anything. So for me, it's communication. You've got to keep the communication open. You know, when we're asking a question, or ask us a question, or if you don't like something, tell us.
I was just about to say that the don't like thing, you know, if there's things that you don't like doing, or, you know, or you know, some clients, you know, might not be particularly good at, or don't want to do that, then, you know, that obviously always helps.
Yeah. So that's the biggest thing. It's, you know, don't just expect us to be able to do it. We need the background as well.
Yeah.
And, you know, we need to ask questions. It's not that we don't know what we're doing. It's because we want to do the job as best as we can. And having that communication, it helps.
Yeah.
Brilliant. Love that. Really, really do. So if someone listening to this podcast is really keen to work with either or both of you, how can they reach out to you? And to even it out, Katey, I'll let Claire go first. Claire, how can they reach out?
Because of what I said.
How can they get in touch with you?
Anyway, don't know. So, yeah, I'm on LinkedIn, Claire Frisby. I'm on Instagram as the Remote Dental Nurse, and Claire Dental on Facebook. But yeah, just send me a message or an email or something, and we can get talking.
Brilliant. And Katey?
Yeah, all the same platforms. I'm on LinkedIn. Got a weird spelling of my name, so just bear that in mind. Katey to be awkward. And then on Instagram, the Dental Virtual Assistant. That's and then it's got my WhatsApp on it as well, because that's the way I prefer to communicate if anybody wants to get in touch.
Perfect. Brilliant. Thank you, ladies. Thank you so much for your time. Really enjoyed this episode, and I can't wait to share it with the wider world. Thanks, guys.
Thanks for having us.
Thank you.
Bye.